If you're living with obesity and would love to try one of the new GLP-1 medications for weight loss, but your insurance doesn't cover it, here are a couple of tips and tricks to look into to see if there's a way around that. So there are 4 diseases that these medications are actually used to treat aside from obesity. And if you fall into one of these categories, it's possible that your doctor can get the medication covered for you for the purpose of treating one of those other comorbid conditions. So those include, number 1, type 2 diabetes. This whole class of medications was actually initially developed for the treatment of diabetes. And so if you have type 2 diabetes, you might be able to get the medication covered for that. And if you have obesity and have not been screened for type 2 diabetes in the last year or more, it'd be important to get that screening done again just to make sure, because if you happen to have developed that complication, this might be a path to getting the medication covered and also getting that condition under control. The second one is sleep apnea. Sleep apnea is super common. It affects up to 40% of patients living with obesity, and most people never get screened or tested. So there's simple questionnaires you can even go online and fill out. It's called the Stop Bang questionnaire. But if you're having symptoms like your partner says you snore loudly, you wake up in the morning exhausted every day, even though you're getting enough hours of sleep, you wake up with frequent morning headaches, or you have excessive daytime sleepiness where you're the person that will nod off every time there's a commercial or you're in the car for 5 minutes. Those are symptoms that might make us think about sleep apnea. So definitely talk to your doctor about getting a sleep study done. And if you turn out to have moderate to severe sleep apnea, your physician might be able to get Zepbound covered for you, which is actually approved specifically for the treatment of sleep apnea. The third one is fatty liver disease, or what is formerly called MASLD, metabolic dysfunction associated steatotic liver disease, which is a mouthful. But basically, this is a condition where your body stores excess fat in the liver, and the presence of that excess fat causes inflammation, and over time can progress to fibrosis, or actually scar tissue in the liver. And so if you have this condition, Wegovy is actually used specifically for the treatment of fatty liver disease with fibrosis. And the last one is established cardiovascular disease. In case no one's talked to you about it, or maybe you haven't seen somebody in a while, it's worth knowing that one of the most powerful benefits that these GLP-1 medications have been shown to have is reducing the risk of further serious cardiovascular events. So in somebody who has had a history of a heart attack, stroke, or peripheral arterial disease, these medications can significantly reduce the risk of future heart attack, stroke, or even cardiovascular death. So if this applies to you, definitely talk to your cardiologist and see if you might be able to get one of these medications on board to help you manage that risk. And it's also going to help with weight loss and overall metabolic health. And if none of these things apply to you, follow along for the next part where I'll talk about some other options.